Hi, everyone. I'm David Munoz, and I am the proponent and passionate about Su Buena Salud. In English, it's your good health. And I'm glad to have you join me this morning because this morning's topic is going to be about a topic that's near and dear to me. It's called nitric oxide therapy. Nitric oxide therapy, it has everything to do with cardiovascular health. A lot of people, especially in my generation these days, suffer from a lot of concerns. You got heart disease, you got poor blood flow, you have cardiovascular complications that come about simply lifestyles and our exposure to, let's say, environmental concerns or lack of exercise or obesity. All these things cause problems with our cardiovascular health. You know, before COVID, cardiovascular disease was and will continue to be after COVID the number one killer of men and women in the United States. So during the last 8 years, I've had the privilege of being able to help a lot of people discover something called nitric oxide therapy. And it is no more than a natural way to address cardiovascular concerns. During the last 8 years or so, I've had a lot of people ask me about nitric oxide therapy. So today, if you'll bear with me, I'm going to address maybe the 3 or 4 most frequently asked questions about nitric oxide therapy. My guest today will be Dan Hammer. Dan Hammer has a master's degree in exercise physiology. He's owned health clubs. He has a wealth of information. He has published a lot of videos and has been recognized as really a go-to person regarding the topic of nitric oxide therapy. And I'm going to ask Dan the same questions I've been asked, most frequently asked questions regarding nitric oxide therapy. So bear with me while I click a button here to my right-hand side and have Dan join us. Hey, Dan, welcome to our morning's broadcast for nitric oxide therapy. How are you?
Good morning, David. I'm excellent. Thank you.
Good. Thanks for joining me. I know I gave you a short notice, but you know, I was thinking yesterday about how many questions we get asked all the time about nitric oxide therapy, and that's one of the reasons I wanted you to jump on with me this morning on the StreamYard, on the video and live Facebook broadcast, and just address maybe 2 or 3 of the most frequently asked questions. And I'd like to just have fun, take just a few minutes to talk about it.
Sure.
So I'll shoot it out to you, Dan. I know you have been working with me, and you were, in fact, the one that introduced me years ago to nitric oxide therapy, which I'm really grateful because I was just saying that people in our generation that are really looking to, you know, I always believe, Dan, that there's 3 stages in life. You know, the first stage is when people take care of you, or kids. The second stage in life is when we take care of others, bringing up families and just going about our daily lives, trying to just making things meet and making life manage. The third stage of life is what I consider, you know, taking care of ourselves, just enjoying our life and extending it and living a quality amount of life. And cardiovascular disease certainly impacts the later generation.
And there might be a 4th stage, David.
Okay, what would that be?
The 4th stage is for those people that missed the 3rd stage of taking care of themselves, end up in the 4th stage where people are taking care of them.
That's very true. You know, my dad, may he rest in peace, he told me, you know, son, he told me this as I was, you know, bathing him because he couldn't bathe himself anymore. He said, you know, son, you're once a man and twice a child in life. And sometimes you just get to that point, right, where we take let's do something, taking care of ourselves. So, but then getting back to our topic at hand, most frequently asked questions about nitric oxide therapy. We'll jump right into it. Dan, can you tell me what you think is the most frequently asked questions for you? Or if I may, let me ask you. I get asked this question.
Sure.
If I take nitric oxide therapy, if I take supplements to help improve my cardiovascular health, how long does it take to work?
Okay, so that varies with individuals. From our experience, if you're using a good product that will help you create nitric oxide, most likely people will see positive improvements in the first 30 days or less. Now, positive improvements, that's a question that I always get. Well, what kind of positive improvements? And they're both subjective as well as objective. If a person's got high blood pressure, then they have blood pressure readings. And as nitric oxide therapy increases, as nitric oxide increases in their vascular system to improve blood flow and vasodilate their system, then for most people, they'll see their blood pressures go back to normal. And there's a quantifiable benefit then because they can see it in their blood pressure readings. Or for a diabetic who has better blood flow, they'll see their blood sugar stabilize and their numbers come down because they do a better job getting blood sugar out of their bloodstream into the cells because of improved what's called endothelial function or capillary function due to nitric oxide. Then there's the subjective ones where I feel better, or I'm more aware of things, or I don't fall asleep at night like I used to. When I wake up in the morning, instead of having to drag myself out of bed, I wake up and I'm ready to go. When I wake up, I'm alert, I'm ready to go. So those are more subjective types of things. And then one other aspect for men, because men deal with ED or erectile dysfunction, you can't have, I don't know if kids are watching here, but you can't have an erection without nitric oxide. So for men, what they will see as they improve their nitric oxide levels is improvement in the performance.
Right, of course. And Dan, one of the things that you just mentioned earlier was, how long does it take? And you said usually within 30 days. My experience has been very similar. When people start addressing their cardiovascular concerns by taking daily supplements, I call it the 2-minute daily discipline, just to take a supplement in the morning that helps with their blood flow. The results are usually 3 weeks to a month.
Yep.
And
sometimes it takes longer. Sometimes it takes up to 3 months. But typically I would say that 80% of my clients usually see some form of positive improvement in the first 30 days or less.
And it has a lot to do with the condition that they're addressing, because let's say like a condition like ED or maybe high blood pressure, that condition could have existed a long time before they actually discovered that there's a natural way to address it. And it could be their body could be really affected. And so, of course, if they've been suffering with that for years, it may take a little longer for them to really feel the positive effects.
Yep.
So let's go back to a second question, Dan, that I'm frequently asked about nitric oxide therapy. They say, what is it? What is nitric oxide? If you could just tell us in a capsule, what is nitric oxide therapy?
So basically, it's what we call a signaling molecule. And what that means is if that molecule's not present in the chain of different things to occur, if that molecule's not there to signal something else to occur, then that thing can't happen. So for example, the major benefit of nitric oxide is that it vasodilates the system by relaxing the smooth muscle of the vascular wall. So if nitric oxide's not there, then the vascular wall stays contracted, which then decreases blood flow, which then increases blood pressure. So it's a signaling molecule used by the body to cause something else to occur. And it's critical. You could not live without nitric oxide. It's that important to your cardiovascular health.
So how did nitric oxide start? All of a sudden, people are talking about nitric oxide, or maybe this is the first time a lot of the people listening to this heard about it.
Sure.
How come the medical community isn't touting about it? How come more people aren't discovering it?
Well, because we can get into politics here. So let me just give you a non-political answer to this.
Okay, good. Do that.
So in 1998, the Nobel Prize in Medicine was awarded to 3 American researchers who discovered how the lining of your vascular system converts the amino acid L-arginine into nitric oxide, and then how it vasodilates the system for improved blood flow. Now, once that Nobel Prize was awarded, then there became an explosion of research in this area. There's now over 150,000 peer-reviewed clinical studies in the area of nitric oxide. And as you've said, most people in the population, general population, have never ever heard of this because for some reason the medical community doesn't ever talk about it. If you look at, like, say, we're in March, so March is like uh, St. Patrick's Day, but last month was February. What is February now nationally?
Heart
It's
month.
Heart Month.
Mm-hmm.
But you never see anything with regards to the American Heart Association or the medical profession talk anything about nitric oxide and what nitric oxide could do to improve people's cardiovascular health. I can't explain why, but it's because of people like ourselves, as well as manufacturers of products that create nitric oxide, who've helped to educate the population with regards to how this Nobel Prize winning information can be practically harnessed for people to take positive steps to improve their cardiovascular health and do it naturally.
Dan, before I get into the final question, I just wanted to just expand a little bit about what you said, and I know that in the medical community, nitric oxides are not very touted, although we know that a lot of the supplements, or the supplement that we use, is recognized in the physician's desk reference, which is a medical reference.
Correct.
As the highest quality L-arginine supplement in the world. And we recognize, or we're aware that the medical community does recognize this natural supplement as the number one. So obviously it's wonderful to be able to be part of it. But at the same time, we also recognize that there's a lot of other interest involved in the proliferation of, let's say, prescription drug medication.
Sure. Mm-hmm.
So, but we'll share one thing before I get into the final question. My experience has been that individuals that do select to treat their cardiovascular concern with a natural supplement that helps, as you say, increase the levels of nitric oxide, have been able to work with their medical professional and reduce their medications through time.
Sure.
Some of them, and I'm a perfect example, Dan, have left medications altogether. I just don't use meds. However, I have been taking nitric oxide supplementation for the last 8 years, maybe 9 years now, and it's just been a godsend. So let's talk about medications a little bit, Dad. The third and final questions that I'd like to discuss with you, and there's a lot more, but maybe in another broadcast we'll do that. The people ask me, I take meds. Will natural supplementation of nitric to increase nitric oxide interfere with my medications? What is your answer to that?
So the answer is no. Nitric oxide, properly formulated nitric oxide product will not interfere with medications. And so a couple things with regards to answering your question. As people improve their nitric oxide levels, first, we always would recommend that people, if you have any questions, whatever supplement that you're using to help create nitric oxide, take the ingredient list to your pharmacist or to your physician. Usually pharmacists know better than physicians, and just ask your pharmacist, are there any ingredients in this product that I'm planning to take? Would they interfere with any medications that I'm on? So that would be the first step.
Okay.
The typical answer is no. And so what happens then is that as you improve your nitric oxide levels, then depending upon what medication you're on, like maybe it's high blood pressure medication, then work with your physician, because as your nitric oxide does a better job vasodilating your system to improve your blood flow, which naturally brings your blood pressure down, then work with your physician in beginning to wean yourself off of medications. And then there's research that shows that as you increase nitric oxide levels in your system, your medications, especially heart medications, work more effectively.
Right.
So again, this is a process of just working with your physician to let them know what you're planning to do, and then asking your physician if they will work with you to help you begin the process of potentially weaning yourself off of medications.
Great. Well, that's absolutely true, and it has a very positive effect because it makes sense. If your blood flow is better, the medications will do their jobs faster.
Sure.
But keep in mind, as we know, that medical treatment is typically treating the symptoms, but not the cause. And so I think medication was designed to be a temporary, addressing temporarily the symptoms until your body can recover and be naturally. So I'd say, just an ending, work with your medical professional. Make sure that that's a good medical professional, because I feel a good medical professional will be proud that their patients, through time, feel better, get better. And one of the things is they reduce their medications. I feel they're doing their job.
Sure.
So, Dan, I want to thank you
You're
for
welcome.
taking time with me. For those listening here on Facebook or YouTube or wherever this broadcast is being promoted, please feel free to give me a call. If you want more information about supplementations that will create nitric oxide in your bloodstream and improve blood flow naturally, we are in this together. We are part of the Million Lives Projects. Our mission is to save as many lives as we can through awareness of excellent naturally based products that can help you live a life, as I call it, getting old younger as we age. That's what it's all about. So thank you. My telephone number, in case you wanted to call me directly, I'll give you the 800 number, because I can take a lot more voice messages there. It's 800-786-2117. 800-786-2117. I'm David Munoz signing off. Dan, thank you very much for joining me.
You're welcome, David. Thank you for inviting me.